Now, I will give the lecture about Part 4, Application of Receptor Imaging in Nerve System. Neural receptor and neurotransmitter imaging can study the vitality of the brain at a molecular level and in vivo. It is non-invasive and has great clinical value. Early diagnosis of disease related to the brain function, understanding the cause of disease, determine the treatment, observing the curative effect and course of the disease. The key points of the brain receptor imaging. First, a suitable radioligand. The quantity of receptors in the brain is very low, so radioligands we prepared must have high affinity and specific activity to pass through the blood-brain barrier, result participating in metabolism in vivo. It is easy to label with radionuclides and retain its original biological activity after labeling. It could bind to the specific sites in the brain. The mechanism of the action is clear. The main radioligand currently developed are dopamine receptors and 5-HT receptors, opioid receptors, gamma-GT receptors, adrenergic receptors. A suitable radionuclide. Radionuclide labeled ligand should be as follows. Its higher specific activity. That means if you label ligand with radionuclide, it should have the high specific activity, so it can bind the receptor with high affinity. The second is proper half-life. It should be not too long or too short. A suitable energy, like 100 to 300 keV in this range, and easy imaging. Then easy labeling and no influence on biological activity after labeling. It's conveniently sourced. Now we commonly use carbon-11, F18 for PET, and iodine-123 and technetium-99m for SPECT. Brain receptor imaging has made remarkable achievements. Doppler receptor imaging is the most widely used. They are used in the early diagnosis of Parkinson's disease and monitoring the effect of transplantation of substantia nigra in the treatment of Parkinson's disease. They can differentiate the pathological type of pituitary adenoma, so prolactinoma or growth hormone tumors rich in TOPA receptor can be treated with bromocriptine instead of surgery. Dopamine D2 receptor imaging used iodine-131 epidermal pyrite has received widespread attention, which reflects the function of the postsynaptic membrane D2 receptor. It is mainly used for the diagnosis of Parkinson's disease and the observation of a curative effect. In recent years, technetium-99m, labeled TRODAT1, has shown a new hope. It is a molecular probe for dopamine transporter. It plays an important role in the information transmission between dopaminergic neurons. It reflects functional changes of presynaptic membrane, and its changes are more sensitive than those of D2 receptor of postsynaptic membrane. Top receptor imaging agents include carbon-11, reclopride, F18 dopa, carbon-11 or F18 labeled spiperon for PET. Tetramethyl-M labeled TRODAT, iodine 123 labeled IBZM, and iodine 123 labeled CIT for postsynaptic D2 receptor imaging agents for SPECT. Recently, 2 dopamine reimaging agents, presynaptic and postsynaptic, have been successfully used to differentiate Parkinson's disease from familiar tremor. F18-FP-FLT is a neural nuclear probe for dopamine transporter in PET, which shows the advantage of positron imaging. With the development of neuronuclear medicine, receptor imaging will be more and more useful in clinical diagnosis and treatment of nervous system disease. Other neurotransmitter or neuroreceptor imaging is also of theoretically and practical value. The commonly used like carbon-11 labeled QNB, carbon-11 labeled diacetmide, 123 iodine labeled QNB, and iodine 123 labeled diacetmide. Using carbon-11 labeled N-methyl-124 piperate acetyldeamine acetylcholine, it was found that the acetylcholine was significantly reduced in patients with Alzheimer's disease, which supports the hypothesis that the dementia is related to the acetylcholine-merrick system defects. Iodine 121 MIBG beta adrenergic receptor imaging in the diagnosis of the phenochromoscytoma and its metastasis, sympathetic nodule cell tumors. Neuropeptide opium receptor imaging revealed the pain was associated with opium receptors. Recently, it has been reported that compared with iodine 123 IMP, perfusion imaging, and MRI before and after acetylcholine stimulation, the gamma GABA receptor imaging with iodine 123 MIMZ has shown that long-term cerebral ischemia can reduce neuron even if the compensatory function of cerebral vascular is good, and the morphological manifestation is brain atrophy. Many antidepressants can block the uptake of 5-HT. Therefore, carbon-11, F18 labeled 5-HT receptor imaging or iodine 123 labeled receptor imaging agents is considered to be a good method for the diagnosis of depression. That's all for this part. Thank you.